بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي.
Being very positive, I am sure that you have learnt well our last lecture, and you have also gone through the book and the experiments that were given in the book, and that were also described somehow in our last lecture. And also, we have some question and answers in our online talk. And I am also hopeful that you have seen the frequently asked question page in which I try to answer your queries that you submitted at the end of the lecture. Just to get an idea, uh, you have gone through the controlled and automatic process. If you are confused about this, I will repeat it a little bit here and give you more input about it. But I will be very happy if you can go back to your textbook and you can see that what we have learned about automatic processes and control processes. Here I am just giving you a brief, concise, what you say, rehearsal of those two processes. Control a process, uh, it requires intentional effort and a kind of full conscious awareness. Uh, you have to consume many attentional resources. You can only perform step by step, I mean one step at a time. It is time consuming process, and you can do kind of high level of cognitive processing uh, during your control process, and you can also do difficult task. Now, the automatic process, as compared to control process, there is little or no intentional effort involved in automatic process, and generally they occur outside our conscious awareness, and they don't use too many attentional resources. So it is not very demanding related to intentional resources. And in automatic processes, multiple operations can occur simultaneously at the same time, and that's why it's also relatively fast. And usually the familiar or highly practiced task comes under automatic processing, such as if you are very experienced in chatting, then you might have seen that you are very quick in typing. And then it involves low level of cognitive processing, uh, and your relatively easy tasks are done by automatic processing. You will see a table on the next slide, and this table uh, can inform you about the difference of control process or automatic process in terms of their characteristics. So take your time. This slide will remain there for 1 minute, and just read it carefully, and then we will proceed further. Well, thank you for reading. Um, about automatic processing or automation, there are two explanations. And I am just giving you an idea here, and I hope you can go through it yourself. First one is integrated components theory. It says that practice leads to integration. Less and less attention is needed. It means that the things that has been in your common practice and you have practiced it too much that it becomes under your automatic processing. Another theory is called instance theory. It says that there are specific answers in the memory that helps you to control to automatically process this procedure. It means you have certain things in your memory that are being retrieved quickly, and then less attention is needed, and these certain things retrieved from the specific memory, they help you to skip the certain steps or procedure, and then you are fast in it and it becomes automatic. So I would like you to discover these two theories and see how they work. Here I am just trying to give you an idea of these two theories. I hope you understand it. That integrated component theory is more talks about the practice-based automatization, and instant theory is about the retrieval from memory-specific answers that reduce the attention required for a certain process. Well, before moving further, I just want to give you an idea of habituation and dishabituation. It is somehow simple idea, and you can learn it very quickly because you have some previous knowledge about it. Habituation is a decrease in responsiveness when we are exposed to a stimulus repeatedly. For example, people who smoke, they do not notice the smell of cigarette or tobacco on their clothes, but the non-smokers do. So this is a kind of habituation. Whereas dishabituation is a change in familiar stimuli that causes us to detect it and we notice it. For example, when the smokers quit smoking, they started noticing how their clothes are smelling. So they started noticing the smell of tobacco from their clothes that they were not previously experiencing. So this is the difference between habituation and dishabituation, and that leads to a paradigm that is called habituation dishabituation paradigm. This paradigm allows psychologists to test the detection abilities of infants and animals because it is hard to detect their abilities, to test their abilities. So, what the psychologists do, they measure the subject's arousal to see if a change occurs when pattern or sound or something in the environment is changed. So, if an animal or infant dishabituates to a change, then they are able to detect the change. But if they does not dishabituate to a change in stimuli, they will not detect the change. So this is a powerful paradigm, and it allows us to detect the abilities of different animals and the infants, so that we can find out how their abilities are working. Okay, let's think about another everyday life question. Do you think using a cell phone while driving is risky? Well, most of you, to be fair, will say yes, and studies also suggest that risk of accident is 3 to 4 times higher when we use cell phones while driving. Strayer and Johnson did an experiment with stimulated driving task, and they found that people who were allowed to use cell phone while doing this driving task, even if they are using earphones, they missed red lights and took more time to apply brakes. So what do you think? What is happening here? Yes, the divided attention is the answer. The divided attention is increasing the risk of the accidents. Now let's study another experiment and see what is happening in this experiment and what this experiment is suggesting us. In this experiment, Participants were asked to judge whether the horizontal or vertical arm is longer, shown on the screen. After a few trials, while the participants were busy in recognizing the longer arm, a geometric shape was flashing here and there on the screen along with the arms. Then, in the recognition test, they were shown another slide in which they have few geometric shapes and they were asked to tell or indicate which geometric shape they have seen on the screen. And some of the participants were unable to recognize the exact shape that was already presented on the screen. So in this experiment, what do you think? What is happening? No? Okay, you may be looking at something directly, but you are not attending it because your focus is somewhere else. And then it is not perceived. So you see that you are looking it directly, but you are not focusing it, so it is not perceived. As in this experiment, geometric shape was not attended, thus not perceived. We usually do not perceive the things that fall out of focus attention. This is inattentional blindness. Do you think it applies when we experience distracted driving that cause accidents? Think about it and find other real life examples of inattentional blindness. Now we see another experiment. In this experiment, two versions of a picture are shown, and the difference does not appear immediately between the two. And the task is to identify the difference, and that requires a concentrated search. So have a look at these pictures and find out the difference. Well, you see that woman on the right side is wearing a scarf around her neck. But did you notice that in one of the picture she is not wearing any scarf around her neck? Another difference. If you see the plates on the tables, they are red, but in one of the pictures, these plates are white. And another difference, the hand position of the woman on the left. Do you notice it changes in any of the picture? Okay, good. So now you see that if we are not able to find the difference that requires a concentration of attention and concentration of search, then we experience the phenomena of change blindness. In this connection, I have uploaded two videos on your LMS account. Please download and watch. Unfortunately, due to copyright, I cannot embed these videos in my video lecture. These videos are from the experimental study conducted by Daniel Simon and Daniel Levin in 1998. Well, here is the link to Simon's lab. You can find more literature there. And you can visit the website directly, or you can also download these videos from your LMS account. And these two videos will help you a lot what we are discussing about change blindness and inattentional blindness. Intuition is probably the topic you would like to learn with interest, if I am not wrong. Does it ever happen to you that you decide on something but you don't have any concrete criteria of your judgment, and only thing you know about your decision is your so-called sixth sense? Or you say बस दिल नहीं माना और दिल ने कहा तो बस कर लिया. Well, let me quote here two examples from Topolinsky 2011, exactly as given in the article. Imagine visiting a car dealer and finding your dream car after hours of inspecting the models and bargaining for possible extras and discounts, and the dealer makes a wonderful offer for you. All the rational facts seem perfect: the price, the car, the good reputation of the company, and there is no hitch or no twist. But however, something feels wrong. Just a hunch for no apparent reason, and there you decide to turn down the offer. Let's see another example. Imagine you are running job interviews. You have carefully studied the applicant's files and all the rational facts that are available, and the applicant's grades, former appointments, recommendation letters. And in the interviews, all of the invited applicants are likable and approachable. They all would do nicely in your team. However, concerning one applicant, you have a certain hunch. He has no particular advantages over the others and even seems a bit less interested, but you go for him. So, what do you think? On what criteria you are taking these decisions? Well, I think you will say hunch or gut feelings. Yes, that's right. But let's call it intuition. Intuitions play a role in our judgment and we experience it in our everyday life, such as doing shopping in the shopping malls and in our social interactions. Several times you may have experienced intuition in making choices. Cognitive psychology explains intuition as a cognitive mechanism outside of our awareness that even if not emerged from our conscious and rational judgment, but still it is shaped by automatic evaluations and accessible semantic categories. We do not find a consensus on the definition of intuition. However, this is a list of short sentences that can help you to see how intuition was defined by different authors. I am going to read these sentences taken from different definitions, and let's see how is the intuition perceived by different authors. Number one, unconscious way of transmitting perceptions. So you will notice this is perception but unconscious way. Judgment without relying on analytical apparatus. So it is a judgment but it does not rely on rationalization. And then immediate apprehension, something that comes to your mind immediately. And then another definition, a feeling of knowing without knowing consciously. So this is the feeling of knowing. So something preconscious or unconscious. Then a non-conscious holistic process of feelings based judgment. You feel this judgment. So apparently there is no connection between the logical control of the decision. Then perceptual process constructed through subconscious linking. So again, there is no conscious self involved in it. Another definition, the capacity of direct immediate knowledge. Another, knowing without being able to explain how we know. So you know that when you are deciding something on your gut feelings or your sixth sense, you don't know how you know this. And then another, in the end, cognitive conclusion based on previous experience and emotional input. It means it does not come from the outside. It has something to do with your previous knowledge, previous emotional input, and certain other processes that have been there in the past, but you don't know actually how your decision is made up. Well, after reading these definitions, I think you have an idea that we cannot reach a consensus, but one thing or two things that you have known from these definitions is the non-conscious or subconscious process. You don't have a conscious awareness of this, and something that is direct, immediate, and you feel like it to be true. Okay, now we are going to sum up this lecture. In next slides, you will see some important concepts that you have read if you have gone through the textbook as well. And I will try to summarize some content, some selective content, and adding some new information. What is attention? Uh, to define attention in simple words, it is the concentration of our mental energies to process information consciously or preconsciously. It means with or without awareness. Our mental sources are limited, therefore, we tend towards selectivity, especially when we are using our mental energies consciously. Preconscious attention. Attending something lying outside our conscious awareness. It is called preconscious attention. There are three components of attention. First is selection. We discriminate and focus on something. Then we lead to the process. So that is called modulation. It means how fast or how slow the selective attention is being processed. And the third part is vigilance. It is about attention span, how long you can hold this in your attention. Exogenous attention. Exogenous attention is stimulus driven attention. If it is external, then it involves sights and sounds. And if it is internal, it involves emotions, thoughts, anxiety. Then we have endogenous attention. Endogenous attention is goal driven attention. And when it is external, it involves active listening and focused observation. And when it is internal, it involves meditation, creative thinking, ideation. So these are major types of attention that you should remember. Signal detection theory. Signal detection theory is about predicting how and why we are able to detect the presence of a faint stimulus when there are several other unnecessary stimulus are being presented. For example, you are asked to indicate the pigeon whenever you see several birds or the names of the birds before you. So there are four options that falls under yes or no. For example, you are accurate in identifying the target stimuli, that is a pigeon. So it means it is a hit, a true positive. Another option would be that you indicate the target when it is not there. For example, you take crow as a pigeon. So this is a false alarm, that is a false positive. And the third option is that you did not notice the target. You did not see the pigeon. This is a miss, a false negative. It was there, but you could not notice that. And then another option is that is called correct rejection. You are correct about identifying that there was no pigeon at all and this was a crow. So this is called correct rejection. So among these four options, signal detection theory says that there is no single threshold or absolute threshold for assuming our detection, and actually our detection depends on our concentration level, our interest, our motivation, our experience, and also on our fatigue level. So this is called signal detection theory. Priming. Recognition of a stimuli facilitated by the prior presentation of a similar stimuli, such as butter, can be processed faster, preceded by bread. And this is called priming effect. Particularly when priming is facilitating, then we call it positive priming effect or facilitating priming. But sometimes it is called a negative priming effect. For example, if the recognition of a stimulus is hindered by the prior presentation of a stimulus that is related but it has an alternate meaning, then the processing will be slow. This is called negative priming, such as pine. The word pine is preceded by the word palm. Tip of the tongue experience. You know that you know the word but not able to retrieve it. It is called tip of the tongue experience. You can say it is the difficulty to access the word in the memory that you know it is there. There are different views about it or different theories that suggest what it causes. Um, One of the view is direct access view. Your memory strength is not enough to recall an item, but it is able to trigger the state. So you remember something, but you are not able to recall the exact word. Second theory is the blocking hypothesis. It says that the retrieval cues stimulate the retrieval of a related word or state, but they block the actual correct word. So you are able to have something related to that word, but you are not able to reach the correct word. Another theory is called the incomplete activation hypothesis. It says that the target word in the memory is not sufficiently activated to be recalled. You are able to remember something, but that target word, which is the correct word you want to say, it is not sufficiently activated. This hypothesis is called incomplete activation hypothesis. Another model that describes the cause of tip of the tongue experience, it is called transmission deficit model. It says the activation of the semantic component of the target word memory is activated. Semantic component is activated, but phonological level of the memory is not activated. So you can say that whenever we store something in our memory, it has two levels. One of the level is semantic component of the word, and the second is phonological level of the memory. So according to transmission deficit model, tip of the tongue experience occur when the semantic component of the target word is activated, but phonological level of the memory is not activated.